Wonderful. So we'll get started. Thank you, everyone, so much for joining us today to learn more about the Unaddressed Project and the report that came out a few weeks ago, a few months ago. Oh my gosh, what is time? It was a little while ago now, but we're very excited to share it with everybody today. So thank you so much for joining us. I'm just going to begin with a land acknowledgement. So my name is Stefania Secha. I'm the Executive Director of Advocacy and Public Affairs at the Women's National Housing and Homelessness Network. And I'm calling in from the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh Nations in Vancouver. I mean, if you don't just mind changing the slide.
Good.
We also just wanted to take a moment for folks in the chat to share their own land acknowledgements where you're calling in from. I imagine many folks are calling in from Calgary, but know that there's folks joining us from across Canada as well. And we just like to take a moment to always acknowledge the Indigenous, First Nations, Métis, people of Canada who are stewards of this land to this day, and that many of the housing crisis stems from colonial violence and patriarchal policies that persist to this day. So thank you everyone for taking that moment, and I do encourage you to share where you're calling in from today. Next slide, please, Amy. So the Women's National Housing and Homelessness Network was the research lead on the Unaddressed Project, and we were joined by many wonderful partners from Calgary, including the project lead, the Women's Centre of Calgary, and the Indigenous Engagement lead, Ms. Kanawa. We also were led by a really wonderful and engaged steering committee throughout this entire project, from Vibrant Calgary, In From the Cold, Safe Blink, the Elizabeth Fry Society of Calgary, Miss Kanawa, YW Calgary, and the Calgary Centre for Newcomers, and the Calgary Drop-In Centre. This project was born from this group of folks coming together with us, the Women's Network. We're the national partner and completed the research. We did the survey working with our partners on the ground and analyzed the data and put the report together really through that critical guidance from the steering committee. So I just wanted to give them all a shout out and a huge thank you, and just show our gratitude for the culmination of this component of the Unaddressed Project, which was the report which we'll be talking about today. Next slide, Eamon. So I just wanted to go over the agenda because really what we're getting at today is what is the Unaddressed Project. So we're going to be talking about the research methodology and data collection process, the statistical portrait of gendered homelessness in Calgary, the summary of key findings and recommendations, and then, as I mentioned at the end, if folks can stay muted, and at the end we will have a Q&A and discussion period. We'll encourage folks to, I'll be minding the chat. So you can have questions in the chat. I'll be saving them for the end and moderating that. But also folks are encouraged to raise their hand if they'd like to answer their question or ask their question live. And we can do that as well. As many of you have noticed, our session today is recorded. So if you don't want to be part of the recording, you really only would be if you begin speaking. So if you do speak like during Q&A period and you don't want to be on the recording, it's very much okay to have your camera off. We are also committed to making this a safe and accessible space for everyone. So I will be, when I'm done talking and passing it over to Eamon, I will be sharing some housekeeping items in the chat. And I also wanted to acknowledge that we will be talking about very difficult things today. So we will be sharing some resources for people as well. And also, if you're having any IT issues, I'll be the person that you can message in the chat, and I will do my very best to help you. So with that, I am going to pass it over to Eamon.
Thank you so much, Stefania. We are good to go. So my name is Eamon Sherwani, and I am currently the Women's National Housing and Homelessness Network's Research and Communications Coordinator. And for Unaddressed, I was one of the researchers on this project alongside our Executive Director of Policy and Engagement, who is Khulud Baig. She recently rejoined us again as well after her parental leave. And this was as well as another University of Calgary PhD student who is not here today, but she worked really hard on this project as well. Her name is Paniz Musawi Samimi. So it was a bit of an effort all around for us. And we have about 20 minutes to present, so I won't completely cover the findings of this project. So I really recommend everyone to read the executive summary or skim through the final report whenever you have time. Um, Unaddressed was a multi-year project focused on improving policies and systems in the city of Calgary so they reflect the real experiences and the real needs of women and gender diverse people in the city and those who are accessing the services. And it's Calgary's first comprehensive community-based study that examines homelessness and hidden homelessness, as well as housing insecurity among women and gender diverse people. Um, and we hope to use this data to inform decision makers about funding decisions and about service provision that ultimately goes back to these groups and helps them achieve that long-term housing stability. Um, this project was a mixed method approach that employed both survey data, which was adopted from the Pan-Canadian Housing and Homelessness Survey, which was a survey that we did like around 2021, which was a mixed method study that explored the housing challenges that women and gender diverse people faced on a national scale. So we sort of adapted this to the City of Calgary context for the Unaddressed project. Um, Let's just see if that works. Awesome. So this project was sort of in, I would say, three phases. It involved the Gender and Housing and Homelessness Survey, which was adapted from the Pan-Canadian Survey, followed by in-person and virtual focus groups that we conducted, and a series of virtual key informant interviews that were um, involving the city's service providers and frontline staff. And we ended up about interviewing about 147 total unhoused and housing insecure women, um, specifically for the survey alone. And that was alongside 27 lived experts in the focus groups. So that was lived experts of like women and gender diverse people who have lived experiences of homelessness and housing insecurity. And that was accompanied by about 19 Calgary service providers who participated in key informant interviews. It was about 12 sector leaders and 7 frontline workers that sat down, I think, in about 60 to 90-minute sessions to talk about what gaps they've personally identified in the housing and homelessness and VAW sectors that they respectively work in. And then lastly, but also most importantly, this project was led by Indigenous partnership all throughout. We had a lovely Indigenous partner, Ms. Fanawa, who oversaw data collection, data stewardship, as well as ensuring that all Indigenous data was presented in a way that was not exploitative to the lived experiences of the Indigenous folks that were interviewed. Let's see, next slide. So participant outreach and recruitment was primarily done at 7 main data collection sites, and we had a lot of help with our partners during this time to help collect that data. So that was the Women's Center of Calgary, as well as YWCA Calgary, amongst a series of others who not only helped facilitate focus groups, but also helped conduct surveys and involved in participant recruitment of lived experts, mainly because they did have that rapport and they did have an understanding of the clientele that access their services. So in doing so, they were able to identify eligibility criteria of who was being involved. So it was like if you were a woman or a gender diverse person at the ages of 18 or older, or if you had any previous experiences of housing insecurity or homelessness. And yeah. And this survey was complemented by not only the focus groups that we mentioned, but also a literature review and a sectoral scan of what the City of Calgary's housing environment, but also socioeconomic condition has looked like for the past 5 years, to help better understand why people may be in the circumstances that they are in at the time that the report was written. All right. I do want to introduce a statistical portrait to you folks. And it's basically just an overview of the overarching data that we found, that the majority of women and gender diverse people that were surveyed demonstrated across the report. And this is not by any means like all the data. So I implore you to go ahead and read the report and see the full findings for yourself. But from what we found, 89% of all survey participants identified as women, with 8% reporting that they were gender diverse. 64% of all participants reported experiencing homelessness at some point within the last 3 years. And that was also accompanied by 59% reporting experiencing some form of trauma or abuse. But this was not specific to whether or not this was during a period of homelessness or during a period of being housed. And that was alongside 64% of all participants reporting some form of disability, and that was one or more form of disability. And we see these figures also increase at the intersection of Indigenous identity. So, about a third of all participants identified as having some form of Indigenous background in our gender, housing, and homelessness survey. 83% of that one-third number reported experiencing homelessness. So, that is a huge spike up from that 64% overall. That was also followed by 82% of all individuals who reported being Indigenous, experiencing some form of trauma or abuse. We will also, I believe, get into later. I don't think it's mentioned in this webinar, but if you folks read the report, there's further data that talks about reports of colonial violence as well as reports of landlord discrimination that Indigenous people also further talk about, mainly as a result of perceived discrimination due to their Indigenous identity. So it's really interesting stuff. I suggest that you read up on it. Lastly, 75% of Indigenous people reported some form of disability, one or more, which is a huge spike up from the, I believe, 64% overall. So let's get into the themes. Our survey and interview data found that there are a series of discrepancies across several sectors and systems that were accessed by the women and gender diverse people in the city of Calgary who struggle with housing insecurity, homelessness, um, and the issues that intersect with that. And the gaps in these systems make their housing insecurity worse as a result. They often exist uniquely for women and gender diverse people because of their gender, and they make it difficult for them to access necessary supports and housing, or also entrench them in cycles of housing precarity that make it very hard to get out of um, that feeling of precarity. So now we're going to explore those a bit. There's a series of intersecting systems. I've made this cute little diagram. I hope you guys are able to see it properly and it's not being cut off. So we have income assistance, immigration status, health and well-being, law enforcement, aka encounters with the criminal justice system, encounters with child welfare, as well as education as barriers to accessing affordable housing, as well as barriers to being able to achieve long-term housing stability. Why is that? We'll start off with income assistance, um, or income support. Our literature review of the Unaddressed Project did a scan of the average provincial earnings in Alberta, which was around $5,545 a month. And that was compared to the median income of survey participants, which you can see here, which was about 2,100 a month for housed participants and 1,500 a month for unhoused participants. Both of them fell well below the poverty line. And an interesting thing to note here was that nearly half of all participants reported being on some form of housing assistance or income assistance. And in the report, you will see that that was mainly AISH, which is the assisted income for the severely handicapped, as well as the ASB, which is the Alberta Seniors Benefit. Um, so with the assumption that a provincial beneficiary of a program like AISH is unemployed, the maximum benefit awarded we found was only $1,901, whereas average market rent was $1,990. It's a dollar short. And I bring up the average market rent because affordable housing, as many lived experts expressed across the study, is not a guarantee. With many having to be on wait lists for months, maybe years, and have experienced homelessness in the process while also having to navigate disability and being without a home. The reality of the situation is that no current provincial income support, as you can see here, uh, lifts a recipient of that support out of poverty, and nor does it sufficiently equip them to be able to afford housing in the city of Calgary. For women and gender diverse people with disabilities, this creates a cycle of housing insecurity and homelessness, where being unable to afford housing because income supports are struggling to keep up with the price of rent um, causes people to struggle. Because income supports are not enough to cover rent as well as additional costs that disability people with disabilities incur due to accessibility challenges, homelessness and insecurity, housing insecurity, they worsen as a result. I'm seeing in the chat, I wonder how many people are seniors. Really interesting read in the report. We do discuss the intersection of seniors as well as disability. Calgary, actually, one of the fastest growing populations currently in the city is aging senior women. And something that we talk about is that, well, if women under the patriarchy are meant to, you know, focus on the home and also are subject to wage inequality, which currently women only make 80 cents to the dollar in Canada, when it's time for them to retire, and and they also are um, incurring age-related disabilities as they age, they have less supports overall that are available to them at their disposal in the system. So at the same time, homelessness and housing insecurity also worsen outcomes for people with disabilities and make it more difficult for them to also seek employment. And I'll talk about this later too, but also afford housing, also achieve long-term stability. It's a cycle. We'll get to it in the next couple slides, but I wanted to point to the statistic here that 32% of all participants also mentioned that they felt that landlords treated them differently when they saw that their source of income was a government income support, which also sort of went hand in hand with our qualitative data, where some lived experts mentioned that income supports like AISH would get taken away perceivedly in a very abrupt and sometimes arbitrary fashion. And basically, that suggested that it caused some feelings of unreliability and mistrust amongst landlords and tenants because the supports themselves are not necessarily offering that stability. So that is followed by immigration status, which was also a reason why so many women and gender diverse people, particularly newcomers, were unable to access the housing supports that they needed. And a large portion of that housing support was needed specifically at the end of a relationship or instances where women were fleeing an abusive partner and they would be taking their children and trying to access shelter systems. The most common cause of homelessness among immigrant and newcomer women was relationship breakdown at 15%. And that was because of status constraints. Immigration status constraints in these situations limit the level of access to employment. They limit the access to services overall as well. So they may not be able to support themselves or have the income needed to be able to flee violence or be able to be independent. They may also not be eligible for certain government programs as well that would be necessary for being able to access housing. I also recall that one service provider during our key informant interviews told us that one newcomer family that was staying in their facility had young children and they were not even eligible to be able to enroll in school because of their lack of status and their lack of documents. As it pertains to this survey data, we find that 49% of all participants were born outside of Canada, with most arriving within the past 3 years. This was accompanied by the fact that 12% reported that immigration-related processes were linked to their housing instability, meaning that like status constraints overall were the reason why they weren't able to expand their capacities to be able to seek employment, to be able to, for example, leave an abusive relationship in order to live independently. And that overall made them more reliant on their abusers, more reliant or less likely to speak out overall. And in terms of speaking out, I also want to touch on language. One in two, one in every two of all of our survey participants spoke languages other than English. That included French, Spanish, and Arabic. And many needed language translation supports required for taking the survey as well. Language to our research team was found to be a very large barrier among survey participants who identified as immigrants and newcomers. And many, as I said, they did require translation services. But I also want to note that it can also be a barrier when navigating support systems overall. Because, as you know, employment requires language, housing and navigating systems and understanding what supports are available to you and why requires language. And there was many instances where we spoke to people and we found that, they'd be going to English classes, but after a certain point, those English classes required that you had to pay for them to be able to achieve a higher level of learning. But how would they be able to do that if they didn't have the employment necessary to pay for those classes, right? So it was a cycle that kept them trapped in that insecurity, essentially. And so, because so many immigrant women are trapped in the system and potentially dependent, they may not be able to vocalize their experiences, which make the risks to their security even greater. In this report, we also explore the need for wraparound services for these groups and in current service provision models so that, they are able to get that nuanced support. And I encourage you all to read about it later as well. So I was talking about this earlier as it pertained to income supports, but I wanted to show you folks this cycle that a lot of individuals go through when they are navigating mental and physical health-related challenges at the intersection of housing insecurity and homelessness. It's very often the fact that it is a bi-directional relationship. And what I mean by that is that health outcomes can emerge as a result of homelessness and housing insecurity, but they can also cause homelessness and housing insecurity. So if we start here, unmet health needs, it's very often the case that as a result of exacerbated physical health and mental health related challenges, people are not able to work or they work less, which directly impacts their housing instability. And in the case that they do become homeless, they are able to access the supports that they need even less, which perpetuates this cycle that they are increasingly unable to escape. Let me see if I can. All right. This was also accompanied by the criminal justice and child welfare services systems. I have coupled them both as law enforcement um, in the same slide as they sort of relate to one another, but I do expand more on it in the report. But I did want to point to this statistic first and foremost, and it was that 1 in 7 of all participants disclosed encounters with the criminal justice system, and of that number, 5% of all participants linked their housing instability specifically to being involved or having a past history with the criminal justice system. And it's often the case that, this is mainly because landlords and property managers may often have restrictions in place and are unwilling to offer a lease to an individual with a criminal record, similar to employers. But at the same time, when individuals can't be approved for housing due to a criminal record and cannot be approved for employment, that allows them to, you know, afford their basic necessities. This also increases their likelihood to become desperate to be able to afford those necessities and reoffend, and thus perpetuates the cycle of housing instability and criminalization for incarcerated persons. What we need in these scenarios is ensuring that when people do exit carceral systems, they have a place to go. They have programs that are able to address their needs in a way that does not hold their history against them, so to speak. 23% also of all participants reported issues with access to justice in instances where they did feel landlord discrimination and or recourse for housing justice. So like eviction cases and things like that. And they were unable to obtain that justice when needed, particularly during tenancy disputes. This was alongside the fact that over 1 in 10 of all participants reported some form of harassment by the police and or a high police presence in their accommodation or neighborhoods that made them feel an overall sense of surveillance, being watched, being judged, things like that. And then our actual report touches quite comprehensively on child welfare services, but I want to be mindful of the time. I did include this statistic here that I wanted to compare. This graph essentially demonstrates in participants' encounters with child welfare services when they were both adults and when they were children. And it compares the overall rate versus Indigenous participants. And overall, it seems as though, Indigenous participants both at the child stage and as the at the adult stage, while when they have children of their own, are disproportionately targeted significantly more than the overall rate. Um, and that's something to be said about the cyclical nature of Indigenous homelessness that we are seeing in the city of Calgary. How all of these barriers, whether it be income support, whether it be criminalization, whether it be child welfare services, they often intersect in a way and they come together for certain groups that feel these identity markers in multiple ways, and they intersect for them to create compounded impacts on their housing precarity. And lastly, I wanted to touch on education. The report also found that education was a large barrier to housing access and affordability for many participants. And it can take form in a couple ways. Newcomers, for example, when they come to Canada and realize that their degrees may not be considered valid in the eyes of employers, and thus may have to settle for jobs potentially outside their career or work that might pay less for what they need to be able to support their families. But then also another factor here is that students may be accepted into university, come across life circumstances, whether it be mental or physical health related, financial or otherwise. And as a result, they may be left with student loan debt, but without the credentials needed to access, high paying or higher paying employment opportunities, making repayment significantly more difficult and increasing their risk of financial insecurity. And that was what was reflected on this quote here from our lived expert. She said, or they said that student loans are impacting their credit scores because I am not working and not able to repay them. Landlords don't care whether it's your student loans, severe mental health issues. I had to give up my uni degree. And that leads us to our second theme. This is one of the largest across the unaddressed report and focuses on the gaps that exist across shelter systems and other services, as well as housing supports in Calgary that are accessed by women and gender diverse people. And one of the primary gaps in support that existed for this group was that 35% of all participants were unable to access a shelter bed when they needed one for a number of reasons. As you can see here, the main reason was lack of space. Safety concerns followed that as well. Um, Unfamiliarity with services available, feelings of not belonging, transportation costs to and from the shelter, judgment or discrimination, being barred from services, staff issues, amongst a series of others. When turned away, it was often the case that individuals instead found themselves relying on more low barrier services within the homelessness serving sector, um, many of which, as you all know, may not be designed to meet trauma-informed needs. As a result, they often encountered environments both within shelters and outside shelters that potentially left them vulnerable to gendered violence. And this was something we heard both from lived experts of homelessness and also sector professionals who witnessed clients come in and just the spaces not being designed infrastructurally to be able to help them. And this reality at the same time also extended to housing supports, but I will get to that later. Yes, so this quote here I wanted to highlight. This person said that we have a lot of Indigenous women fleeing from domestic violence. They have nothing. 3 months of case management support is just not enough. If they need help getting on, oops, how do I go back? If they need help getting on some sort of income support, sometimes that can take even 3 months or more. And then at the end of those 3 months, they're back in a similar situation, needing support again. Having long-term case management would be much more beneficial. And that is just speaking on the capacity constraints that a lot of shelters currently do have. And it's not that, you know, service providers don't want to help every single person that comes through the door. It's that, the services and organizations themselves are so constrained that it overwhelms the whole system altogether. Um, and it's also important to note here that service providers themselves are often working within those systemic constraints, and the options they can offer are limited by the resources that are available. So in turn, it can be perceived often by clients and lived experts as a lack of care or due diligence by those experiencing heightened and intersecting vulnerabilities. And I think there was this one example that I remember that one participant found it, they found it counterintuitive that the places that housing providers were offering to her were, as I quote, she said that they were full of men and unclean, as well as being considered unsafe and substandard by other women. And she didn't know why housing providers were offering those to her, especially, for victims who were fleeing domestic violence. So it can create a sense of like dissonance amongst people and like mistrust for the system, um, despite the whole system overall being overwhelmed. Additionally, it was also found that, when women were able to access housing, there were a series of issues that arose there as well. And that was namely like encounters of discrimination in the form of tenancy practices and quote unquote like risk mitigation in housing. And this was especially common amongst Indigenous participants, where nearly one in every two Indigenous participants in our survey reported experiencing some form of landlord discrimination. And I can recall actually, one service provider that we interviewed said that they weren't getting any responses through their company email because their organization had an Indigenous name. So when they emailed this housing provider from an alternative Gmail account, they got an instant response regarding the listing inquiry. And then other service providers also mentioned that, landlords outright told them, I don't rent to you people, quote unquote, regarding Indigenous people, which was crazy. Some other reasons participants said that they experienced landlord discrimination was income source, as I mentioned earlier, and this was followed by credit scores, and then perceived discrimination on the basis of both race and ethnicity, followed by discrimination on the basis of Indigenous identity, age, whether that is both younger or older, having children, and lack of references as well as disability. So some things to think about. We expand on all of these as well in the report. If you guys are wondering why maybe those numbers are reflected the way that they are, lots of good stuff in there. So, our next theme focuses on funding or a lack thereof across service provision in Calgary. I'll be brief, and I just want to be mindful of the time, but essentially what I want to say is that service users across the report consistently reported being unable to access the supports that they needed because services were at capacity, um, under-resourced, or unavailable altogether. At the same time, service providers also described working in such environments that involved like staff shortages, long wait lists, high turnover, burnout, unsafe working conditions. And they mentioned how hard it is to be able to collaborate across the sector if organizational funding requirements maybe compete or are conflicting with other organizations they are hoping to work with, despite having the same individuals accessing both of these spaces. So this is something what one from frontline professionals said. They said that it feels like we have to fight for every dollar, every penny. Often women with children, and gender diverse folks don't fit into that typical quick funding box like domestic violence funding. Um, yeah. In the full report, we go into further depth about how many organizations have to rely on volunteer contributions just to be able to increase their capacity, and how many rely on like quote unquote community kindness just to be able to create, a semblance of a system that operates at or beyond capacity. And all of these issues at the end of the day, they directly impact the women and gender diverse people accessing the organizations that are afflicted. So I did create this diagram for you folks. It starts with the housing crisis worsening, where waitlists grow and cases become more and more complex. Um, Staff in these instances, very often, they take on high workloads, leading to burnout and high turnover, which, leads to a loss of organizational knowledge and a decline in service quality, where clients may find that, caseworkers that are new to the job might not know the nuances of their situations potentially, or they might not be receiving the same treatment, or they might not reflect a trauma-informed nature that they require. And at the end of the day, it may result in prolonged crises for clients, overloaded systems, and chronic underfunding as a result of this. So, for our fourth theme, we talk about the increasing evidence on the gender-specific pathways into homelessness, including findings from this project, which highlight the interconnected supports required to address housing precarity and signals essentially a clear need for these sectors to move towards a more coordinated and integrated approach. Um, Service providers and frontline staff across the study pointed to difficulties in cross-organizational collaboration, as I mentioned before. Um, particularly due to operating within differing funding structures and mandates amidst limited capacities and varying eligibility criteria contingent on the clients that they serve. For example, homelessness and VAW sectors also like often serve the same clients. When one system becomes overwhelmed, it's very often the case that they go to the other. But eligibility criteria can often constrain that access, which becomes a problem and does result in instances of hidden homelessness. So then the question becomes, if services are struggling to meet growing need, where then are these people staying during their periods of homelessness? So hidden homelessness, as many of you may know, refers to situations where individuals lack access to safe, stable, and permanent housing, but are not visibly experiencing homelessness. Because many people who are couch surfing or staying temporarily with friends or family or remaining in unsafe housing situations, or otherwise are not captured through traditional methods of enumeration, these experiences very often are excluded from visible homelessness counts. So, as a result, women and gender diverse people experiencing homelessness are frequently rendered invisible in data, policy, service planning, despite often facing significant housing instability and safety concerns. And we hope at the end of the day that the data found in this report serves as a means to fund more research around the hidden nature of women and gender diverse people's homelessness in Calgary. So let's look at the numbers here. 44% of all individuals who reported experiences of homelessness reported staying at someone else's place due to safety concerns at shelters or a lack of housing overall. 10%, which is 1 in 10, stayed in a public space or a place not meant for living, for example, the transit stations. 18% of unhoused participants had remained in an unwanted relationship for shelter, despite the risks. 30%, which is nearly one-third, reported being homeless for a year or longer within the past 3 years. 22% stayed in hotels, motels, or similar accommodations due to a lack of safe, affordable housing or shelter availability. 35% reported being homeless 2 to 3 times within a period of 3 years. 13% stayed outside in a tent, encampment, or a self-built shelter. And 10% became homeless under the age of 16. Our last theme focuses on the structural gaps in the supply of safe, accessible, and affordable housing. At present, Alberta is one of the only provinces, alongside Saskatchewan, that does not have any legislation that regulates the yearly increases made on the price of rent. This means that landlords are able to raise the price of an apartment unit from, for example, $1,000 to $1,500 within the span of a year and have it be completely legal, despite this being the reason for many individuals being priced out of their units. And these price increases are happening alongside income supports, being well under the poverty line in the city of Calgary as well. So I want everyone to be cognizant of that. Because of this, many individuals reported having to compromise on other aspects of their lives and basic necessities in order to afford housing. 53% of all of our survey participants who reported being unable to access housing said that they could not afford a place to rent at current market rates. 43% reported not being able to afford the upfront costs associated with securing housing, which involves moving fees as well as a deposit. 21% reported that units were in poor physical condition, and 21% also said that the affordable options they could find were not safe for them. So there's also that gendered element there that, is women are not willing to risk their safety and compromise that if an affordable option does exist, because that means, that in their life. Um, Lastly, 1 in 10 had no income at all to sustain themselves. So, um, try to move this. Okay. Um, and then our last slide focuses on actions taken by participants in order to afford shelter amidst these constraints, as well as their basic necessities. Um, where is my cursor? Okay. So we see here on this graph, we compare individuals that were currently housed and those who were currently housed. We see over here that 75% of all women and gender diverse people who were able to retain their housing said that they cut back on necessities. Nearly 60% relied on food banks. Nearly 50% said they had to borrow money, amongst a series of other things. And then I did want to point to the statistic here that I mentioned earlier. 18% of all unhoused women attested to remaining in an unwanted relationship for financial support just to retain housing. That was similar to the under 10% for those who were currently housed. So that is saying something about, the steps women and gender diverse people also feel like they feel that they are forced to take in order to be able to sustain that shelter and why they choose that over accessing shelter in the first place. It's something to be said. So, we have a series of recommendations involving strengthening cross-sector collaboration and shared understanding across the sector, enhancing gender-responsive and intersectional supports as it pertains to shelters as well as housing, empowering sector impact, particularly boosting funding, removing barriers and supporting access to allow women and gender diverse people to be able to access these supports and have those nuances there ready for them, those wraparound supports that are able to address their housing precarity every step of the way where it occurs. And lastly, expanding affordable, adequate, and accessible housing. What does that all look like? It could look like ensuring income supports reflect the cost of living. It could look like expanding funding for service providers to adequately meet needs on the ground and in a comprehensive way that involves tailored supports and programs such as language services and childcare that otherwise allows women and gender diverse people to expand their capacities and pursue employment, just to name a few, of course.
Thank you to everyone so much for joining us here today. Again, another shout out to our research team at the Women's National Housing and Homelessness Network that helped compose the report. A huge shout out to our steering committee members, again, who helped guide the report and gave us space to do the surveys themselves. And then a really, really big shout out to the project lead, the Women's Centre of Calgary, who've been an incredible partner throughout this project. As Cassandra from WCC shared about the Unaddressed Project itself, the report is one component, but there are still a lot more exciting things coming up. So do encourage you to follow those links to unaddressed.ca to follow and stay up to date on the work happening there. Shout out to subscribing to the Women's Network if you're inclined to stay in touch to see the work that we'll be up to, pushing the federal government and other levels of government to do that work.
Today to read it.